The magnificent human brain is one of the most beautifully complex things in all of our universe. However, it still can be subject to trauma from things like stress, distress, medications, chemotherapy, radiation, cancer, aging, hormonal changes. These cognitive changes in the cancer care world are known as Chemo Brain. Welcome to the Recovery Room. I'm cancer physical therapy specialist, Dr. Leslie Walke, where today we are talking about cognitive changes resulting from cancer and cancer treatment. Now, though the term chemo brain is relatively common, it's technically not accurate. First, because it is not really proven that chemotherapy is the sole culprit of these mental fogginess issues, and secondly, a lot of people that have chemo brain from cancer treatment have never had chemotherapy. Typical symptoms of chemo brain or cancer-related cognitive impairment are confusion, difficulty concentrating, feeling unusually disorganized, short-term attention span, short-term memory problems, taking longer than usual to complete routine tasks. Now, chemo brain or cancer-related cognitive impairment has been shown to be a real thing. It is documented. Physicians and nurses know it exists. However, we don't know a lot about it. There's no true definition for it, and there's no diagnostic testing for it. As a matter of fact, many people who have cognitive impairment from cancer or cancer treatment test out normal. So it's very frustrating. So please know that even though it's in your brain, it's really not in your head. Learning adaptations and coping mechanisms are going to be key. And that starts with tracking what exactly your issues are so you can better understand them and better create coping strategies. Those strategies include getting a good night's sleep, making sure you're well hydrated and well fed, making sure that you plan ahead so you have all the tasks lined up that you know that you need to complete for that day. Use a calendar. Use your smartphone. Hey Siri, remind me to call John at 2 o'clock to ask him about the windows. Hey Siri, remind me on the way home from work to pick up a gallon of milk. Those things are invaluable. Set timers. Use the technology around you to help you plan out your day, put it in a schedule so you don't have to remember as much. Remember nothing. Write it all down, put it in your phone so you can open up your attention units for things that matter instead of remembering menial tasks. Now, while there is no direct evidence that exercise specifically improves chemo brain or not, exercise certainly has been shown to improve cognitive function, decrease the risk of Alzheimer's, and is generally good for the brain. And of course, as a cancer survivor or cancer patient, you should be getting your 150 minutes of exercise per week anyway. So, of course, if you are having cognitive issues, you need to be exercising. Again, make it easy, make it simple. Lay out your plan, have your clothes ready, have your shoes ready so you can decrease the stress, make your world a lot easier. And don't forget that the human brain is an organ, just like our heart and our lungs, that we need to care for. So treat it well. I'm Dr. Leslie Walke, signing out from the Recovery Room. Let's talk again soon.